Next, I'll show you the application of acupuncture for anterior knee pain. So this pain is located between the stomach and the spleen meridians, and will you be using points of both stomach and spleen, as well as directly into this trochlear groove underneath the patella. Make sure that your client's knees are bolstered, so you want some bend in the knee, otherwise you won't be able to place the needle appropriately where you'll want it. So we'll begin by using some local points here, and this is going to be placing the needle directly underneath the patella into this trochlear groove. And you're going to go on both the medial and the lateral sides. So it's a nice way to think about you're kind of crisscrossing the needles underneath the patella. This is a thin needle. This is about a 38 gauge needle. So the thinner the needle, the better here, because it's going to be more comfortable for your client. And you don't need a big needle in order to really dispel this local chi and blood stagnation. So I'll show you the lateral side first. So you'll find the bottom border of the patella, and then you just slide off the patellar tendon. So it's in this groove, in this lateral groove, directly off of the lateral side of the patella tendon. And you feel the depression here, and you're going to want to aim sort of crisscross. So you'll aim towards this anterior medial side of the patella. And you'll slide the needle directly up and under the patella. And you're just grazing basically that bottom surface of the patella. And then you'll repeat the process here on the medial side. So find that bottom border of the patella, and then this medial portion where your hand will fall off of this patellar tendon, and then aim towards this anterior lateral portion. I will say that this needle on this medial side sometimes is a little bit trickier to place than the lateral one. So that's okay. Just do your best, and you don't want to hurt your client. So try to get the needle up and underneath the patella. Aiming here to this lateral surface. So I'm happy with that. We got about an inch of that needle up and underneath the patella. And these are going to work really well to help dispel that local chi and blood stagnation. We can also use the concept of a Dui Yao here, and if you're inclined, you can place a second needle a little bit further down the leg, aiming in the same direction. You can place a second needle on both sides. So if your client has a really stubborn case of this anterior knee pain, they're really in a lot of pain, you feel like there's a lot of inflammation, a lot of stagnation going on, go ahead and place a second needle along this line here. I'll now show you some distal points for this anterior knee pain. So we're going to work with the same side with the anterior knee pain. So you've already placed your local points directly underneath the patella, and now we're going to work up here in the upper thigh. And these points I'll show you are along the vastus lateralis group. And the way that you can find those is you find the top border, the superior border of the patella, and then you find the ASIS, the anterior superior iliac spine, and you connect a line between these two. And now we're going to place needles 2 inches, 3 inches, and 6 inches along the upper border of the thigh along this line. So it's kind of an imaginary line, so you can just, trace it out and place it with your mind. And now you can see where you're aiming. So we're here on this vastus lateralis muscle. So we'll go 2 inches above the top border of the patella directly into this muscle group. And what we're working on here is dispelling chi and blood stagnation into this thigh group. So sometimes this thigh group, especially the vastus lateralis, can get really stagnant with chi and blood, and it can really start to pull inappropriately on the knee. This can contribute to inappropriate biomechanical motion, which also results in this anterior knee pain. So here we have our first needle about 2 inches above, and then our second needle goes an inch above that. So this is 3 inches above this top border of the patella, and this is right along the stomach meridian. And again, find that nice chi sensation here. And then our final needle is about 6 inches above. This is a really nice way to help relieve that pain. Make sure you do these on the same side or the affected side. I'm going to show you a really similar concept for distal points for anterior knee pain, but this time we're going to work on the medial side of the leg. And again, with the same principle as what we showed with the vastus lateralis group, make sure that you needle these on the same or the affected side as the knee pain. And these points are located on the spleen channel, which is on the vastus medius group. So you'll find the first point directly above the superior border of the patella, and this is in the bulge of the vastus medius. It's a really notable landmark. Most people have a really prominent bulge here in the muscle of the vastus medialis, and this is where you're going to place your first needle. And the reason why we're going to the inside of the leg, to the spleen channel, is that the spleen channel tends to be really deficient here in the leg. So we're working to bring more qi and more blood to the spleen channel. So we're working to correct the imbalance between the stomach channel, which has too much qi and blood, which results in stagnation, to bringing more qi and blood to the spleen channel, which is deficient, doesn't have enough qi and blood. And this will really help to stabilize the knee joint and relieve that anterior knee pain. So here's our first needle. And then again, this is a Duyao concept. So we're going to place a second needle an inch proximal to this first needle. So again, we're still in the vastus medialis. And find that nice qi sensation. It's really, really important when you're working with these big thigh muscles. You have to get that nice qi sensation, especially here on the spleen side. The spleen side tends to be a little bit weak, a little bit more prone to that deficiency. So use your toolkit, use your acupuncture knowledge in order to make sure that you obtain a strong qi sensation right here in the spleen channel. We can also take advantage of the concept of imaging when it comes to anterior knee pain. And just as we used the knees for the elbow when I was talking about tennis elbow, we can also use the elbows for the knees in order to treat anterior knee pain. With this technique, a really nice thing to do is to palpate around here, the condyle, this lateral condyle, and a little bit lower into the associated musculature and structures. And you can go even a little bit above the elbow. And what I like to do at this point is I like to ask my client, what is the point of maximal tenderness? You don't have to push super hard, but just make sure that you're kind of pressing around the area. And they'll tell you, some people are just way more tender here below the elbow, other people above the elbow. And when you find these nice tender points, then you'll just insert your needle, go for about perpendicular insertion, about an inch depth. And I like to place a couple of needles around this joint. And this again, we're using this concept of imaging to help dispel stagnation in the knee. So we're not necessarily on any particular channel here in the elbow. We're just working with empirical, or known as Asher or tender points in the elbow in order to bring more qi and blood to the knee. So once you have those placed in the elbow, then that's exactly what you're going for. So you can place anywhere from 2 to 5 needles in the elbow to really bring more circulation to the knee.